In the United States, approximately 500,000 vasectomies are performed each year. Men are choosing vasectomy as a means of permanent birth control because it is safe, effective, and can be performed using minimally invasive techniques. This video will familiarize you with the vasectomy procedure. Here's what a successful vasectomy accomplishes. It interrupts the flow of sperm from the testicles to prevent pregnancy. The testicles are the sperm-producing organs located within the scrotum. Sperm cells are produced within the testicles and stored in the epididymis, which is adjacent to the testicles. There, sperm mature and eventually are transported through the vas deferens to the prostate gland and seminal vesicles for ejaculation. A vasectomy interrupts the vas deferens and prevents sperm from entering the ejaculate. There are a couple of key points that must be emphasized before considering vasectomy. First, a vasectomy is considered a permanent procedure. Individuals considering vasectomy should have clear intentions and desire for a permanent form of birth control. If there are any reservations, vasectomy is not the right choice. Vasectomy reversal procedures are sought by as many as 10% of men after vasectomy. Although it might be possible to reverse your vasectomy, there's no guarantee it will work. Reversal surgery is more complicated than vasectomy, can be expensive, and is ineffective in some cases. The longer you wait to have a vasectomy reversal, the less likely it will be successful. Other techniques also are available to father a child following vasectomy, such as sperm retrieval and in vitro fertilization. However, these techniques are invasive, expensive, and not always effective. Second, a vasectomy is a very effective method of birth control, but it is not perfect. Vasectomy has many advantages over non-permanent forms of birth control, but failures do occur. Failures are extremely rare and can be minimized through proper follow-up with your doctor, which we will discuss later in this video. Also remember, vasectomy does not protect against sexually transmitted infection. There are several methods your urologist may employ to perform a vasectomy. Generally, it is a 15 to 30-minute procedure performed in an outpatient setting in either the physician's office or a surgery center. It is usually performed under local anesthesia and occasionally light sedation. Local anesthesia involves the injection of a medication into the tissues to deaden the nerves. This can be uncomfortable, but is easily tolerated, and the anesthesia works very quickly. After the administration of local anesthesia, you'll be able to feel the doctor working and touching your skin, but you will be unable to tell the difference between touching with a finger or a needle. Light sedation can be done either with a Valium pill taken a few minutes before the procedure, via an injection into a vein in your arm, or some offices offer nitrous oxide sedation. Although you remain awake, the medication will help you relax. After the anesthesia is given, your urologist will identify the vas deferens on each side and bring them to the skin surface through either a small puncture site or a small incision. The vas deferens tube is then interrupted by either removing a segment, cauterizing the inside of the tube, placing sutures on the ends of the tubes, placing clips on the ends of the tubes, or a combination of these four methods. Your urologist may also send segments of your vas deferens to a pathologist to confirm removal. Most men can go home immediately following the procedure. If you are sedated for the procedure, someone must drive you. Your doctor will discuss oral pain control options after vasectomy, but men will rarely need anything other than over-the-counter analgesics. Opioid pills like Vicodin and Norco have side effects and a strong risk of addiction and should be avoided unless absolutely necessary for pain relief. The local anesthetic injection typically wears off between 1 and 2 hours after the procedure, and it is recommended that over-the-counter pain medication be taken prior to that time. Many men also report relief from application of ice or other cold packs to the scrotum. The cold packs help to decrease bruising and swelling and also provide some pain relief. Plan to wear supportive clothing such as compression shorts, tight-fitting underwear, or an athletic supporter after your procedure as well. Plan to significantly limit your physical activity for 24 to 72 hours after the procedure to allow proper healing. Avoid excessive motion, lifting, straining, or exercise, as it increases the risk for swelling, bruising, and bleeding following the procedure. It is normal to have moderate discomfort for a week or more. The amount of discomfort after the initial 72 hours will help determine your proper level of activity. If it's uncomfortable, don't do it. You may shower the next day after the procedure, but submerging in water should be avoided for the first week. Most men can return to sexual activity within 7 to 10 days. Your doctor will review care of the incision or puncture site. Generally, keeping the area clean and dry is all that is necessary. If sutures are placed, they should dissolve within 7 to 10 days. The most important follow-up, of course, is to have your semen specimen checked for the absence of sperm. You must continue to use another method of birth control until your doctor has told you that you are clear of all sperm. You must wait at least 8 weeks from your procedure and ejaculate at least 15 times over that time period. A single specimen is collected at home and brought to the office for analysis. The semen ejaculate is analyzed closely to confirm the absence of sperm. Your doctor will call you with your results. Don't be alarmed if there are still dead, non-mobile sperm in your specimen at 8 weeks. This will require an additional specimen after waiting 8 more weeks to make sure that all dead sperm have completely passed. In a small percentage of cases, live sperm continue to appear or reappear in the ejaculate after vasectomy, which can result in unintended pregnancies. This can occur through a process known as recanalization. Essentially, the two ends of the cut vas deferens can heal in a way that allows for sperm to travel between them. This usually occurs early in the healing process and is detected with proper follow-up as recommended by your physician. Recanalization can occur years after vasectomy, but this is estimated to happen in less than 1 in 2,000 patients. No matter how minor, all procedures carry some risk. Although vasectomy is very safe and effective, there are risks to be carefully considered. Anytime an incision or puncture is made in the skin, there is a risk of infection or bleeding. Care is taken prior to the procedure to clean the scrotum and the vasectomy site with a surgical prep solution to minimize the risk of infection. Your doctor may ask you to take antibiotics briefly following the vasectomy. Bleeding and bruising are typically minimal. As previously discussed, the risk increases depending on your physical activity following the procedure. There is no research evidence that supports an increased risk for cancer or other health problems related to vasectomy. Occasionally, men will develop a sperm granuloma at the site of the vasectomy. This is where small amounts of sperm make their way out of the end of the vas deferens, producing a small amount of irritation and a small nodule. These are essentially painless and harmless and do not indicate any form of problem. Very rarely, men will have pain as much as a year beyond the healing period. When this happens, it is usually managed with intermittent medication. If proper healing occurs and the flow of sperm along the vas deferens is interrupted, sperm continue to be made in the testicles, but are reabsorbed and recycled by the body after they've reached a certain age. Vasectomy should not affect your erections, your sex drive, or your ejaculation. Sperm that travel through the vas deferens make up only a small percentage of the total fluid in an ejaculation. There is no noticeable difference in the ejaculate after vasectomy. Testosterone production will not be affected by vasectomy. After carefully researching and considering vasectomy as a means of permanent birth control, if you feel ready to proceed, then a few small steps in preparation may make the process safer and easier. First, avoid anti-inflammatory drugs such as ibuprofen or aspirin for at least 1 week prior to the vasectomy. These medications may increase the risk of bleeding. Of course, if you're taking any medications prescribed by a physician, be sure to let your urologist know so that he or she can decide if you should continue them. Next, make proper preparations to schedule the procedure during a time when you have ample opportunity for rest and light duty for about a week to limit your risk for pain, bleeding, or other complications. Shaving the scrotum yourself may also help to minimize discomfort before and during the procedure. Make sure you have snug clothing, ice packs, and some over-the-counter analgesics ready at home. Vasectomy is a very safe and effective, minimally invasive procedure to achieve permanent birth control. It should be considered permanent and not entered into with the intention of future reversal. It is important that you follow your doctor's recommendations before, during, and after the procedure for proper healing and best results. This introduction is complete. We hope you have a better understanding of how vasectomy works. Please let your urologist know if you have any questions.